The CDC is being sued by two doctors because they have never tested the full vaccine schedule for the cumulative effect of all the toxins. I know what you're thinking. There's no way they haven't actually tested the 72 vaccines that are on the schedule altogether. And I'm telling you, they haven't. They have actually done no cumulative studies. So this could be really big because if these two doctors win, it should be a lot easier to get exemptions in states like California and New York and just be able to look at good science and good things for health for our kids. But yeah, this is awesome that this lawsuit is happening, so we'll have to follow this closely.
The way this lawsuit is being celebrated is comical. Like, what CDC do you think you're suing? The one already stretched thin with staff being laid off and resigning? Okay. And let's look at who's filing this. Paul Thomas and Kenneth Stroller both lost their medical licenses. Do you know how hard it is to lose your medical license in pediatrics? We're talking repeated malpractice, criminal activity like child pornography, or in their case, spreading vaccine lies. It's one thing to discuss a benefit and risk, but these clinicians flat out spread misinformation disguised as disinformation. They know what they're doing, and they cash in with book deals and speaking engagements. Thomas even published his own study comparing vaccinated and unvaccinated kids. Sounds legit until you realize it was from his own patients and not peer-reviewed. And it wasn't harmless. Kids in his practice ended up hospitalized with preventable diseases like rotavirus and tetanus. That's why Oregon pulled his license on an emergency basis. Stroller, he was handing out shady exemptions that didn't meet CDC or state rules. License gone. And now these are the guys filing a lawsuit. Let's be clear, filing doesn't mean anything, and of course the anti-vaccine crowd is celebrating. Celebrating what? Two discredited doctors filing paperwork? They also love to say 72 vaccines, like kids are getting 72 needles all at once. No, the schedule is spread out over 18 years. Many shots are combined, so it's not 72. And today's vaccines often have fewer antigens than older ones. It's a scare tactic, not reality. And here's the frustrating part, the moving target. First, it was vaccines haven't been studied at all. When that was disproven, it became they haven't been studied enough. Now, it's not studied in this exact way. Every time the science answers, they shift the question. Because the truth is, they don't actually care about studies. They'll keep moving the goalpost, and none of it will ever convince them to actually get vaccinated. Vaccines prevent serious illness, hospitalization, and death, and when it comes to the routine schedule of 72 vaccines, the benefits outweigh the risk. I see it with my patients, and I trust it for my own kids. So yeah, let's watch where this goes. Save this video and mark my words. It'll either get tossed out in a dismissal, or on the tiny off chance they actually push through safety studies, which they won't, it would show exactly what we've seen all along. There are no cumulative effects of vaccine toxins because there are no toxins in vaccines.